Alrighty, I think we're going to get started. So thank you everybody for joining us today. So this is our Tuesdays at 10. We are very excited to bring you another new topic today. So for those of you that don't know me, my name is Rachel and I am one of the New South Wales trainers here at Professional Beauty Solutions. Now, if anyone would like to ask any questions today or comments or anything like that, I do encourage you all to have a chat. If you want to pop your questions into the question box or into the chat box, just make sure that when you do it, press reply to everybody, just so everyone can see your amazing questions and answers as we go through today. So let's have a look at what we're going through today and some upcoming topics as well. So for Tuesdays at 10, we have a new topic that happens every single month, and we come to you live at 10 a.m. on the first Tuesday of each month. So far we've covered topics such as skin barrier function, we've gone through advanced consultations, we've gone through how to prep your skin for peels, deep dive into pigmentation, and today we're going to go through treating acne. We're really going to explore that. We're going to explore what acne is, the different types of papules and pustules that we can see on our client's skin, and then we're going to have a look at more of those ingredients that are really going to suit those clients and how we can treat them at home, but also what we can do in clinic to really effectively treat acne. Now, next month, we are going to be covering some retail training. So some tips and some tools to really how to nail that retailing. If anyone does have a topic that they are particularly interested in or would like the education team to cover, please let us know. Pop it in the chat box again or email us directly at education@probeautysolutions.com.au, and we'll be more than happy to have a look at putting something on specifically for what you guys would really like us to cover as well. All right, so let's get into it and let's talk about acne. Now, acne is a very common skin condition, and it's something that most of us will experience at some point in our lives. It isn't just reserved for those going through puberty or those teens. It can affect us all the way through our adult life as well. It has absolutely no boundaries, it's not prejudice, and it can be not only present on the face, but we can see acne showing up on the chest, on the shoulders, and on the back as well. Now, your acne is an inflammatory disorder, and it's caused by excess dead skin cells and sebum that clog the hair follicles and block the pores. Now, the clogged pore doesn't allow for oxygen flow down into that hair follicle, and this leads to the abundance of P. acne bacteria. Now, when that follicle then becomes full, it breaks and it spills its contents into the dermis and causes inflammation, which can then result in loss of collagen and acne and scarring. So it can be present or presented as whiteheads, as blackheads, papules, pustules, nodules, and cysts. And we're going to go through and define each one of those as well shortly. Now, there are four main factors that really cause acne. The first one is excessive oil production, and the role of the sebaceous glands has long been recognized as a key factor in acne. The increased rate of sebum production is one of the most important factors involved in the development of acne lesions. Sufferers of acne secrete a lot more sebum than their normal counterpart or that normal individual. And the severity of acne that someone experiences is related to the amount of excess sebum that is being produced. Another key factor there is the hair follicles clogged by oil and dead skin cells. So when that pilosebaceous unit is obstructed by the accumulation of excess dead skin cells, it starts to obstruct that flow of oil or that flow of sebum. This excess oil and that excess skin starts to build up, and it's unable to then clear out. This then leads to a very good environment for a P. acne bacteria to multiply. So we see that bacteria, we see excessive growth of P. acne bacteria. And the other thing, or the other factor that can cause acne or assist with that acne, is an excessive activity of hormones or androgens in the skin. And in particular, we're talking about the hormone testosterone. Now, testosterone is present in all of us. All of us have testosterone flying around. What it does if we have an excess amount is it starts to increase sebum production. And when testosterone is being purged through the skin, that excess testosterone, we typically see it show up as cystic breakouts occurring on that skin. So what exactly is our P. acne? It is a bacteria, and it grows deep inside of the pore, and it feeds on sebum that's produced around that sebaceous gland, and it's surrounding the base of that hair shaft. Now, P. acne bacteria is actually present in all skin types. All of us have it in there. However, most individuals with acne symptoms have an overgrowth of P. acnes bacteria in their skin. Now, one of the many myths, and there's lots of myths of acne out there, but one of the many myths out there is that it needs to run its own natural course. However, whilst it's not a physically serious condition, acne can have a really profound and lasting effect on an individual, and it can really affect a person's confidence. Acne's impact can lead to anxiety in a person, to loss of confidence, social withdrawal, missing out on school or work or functions. Things like grades can suffer. It can lead to bullying and isolation as well, along with depression and suicidal thoughts. They've all been linked with bad acne. Dark spots, scarring, PIH, so post-inflammatory hyperpigmentation on the skin, can occur as well, and these can take months or even years to disappear. And cysts and nodules can cause permanent scarring. The good news is, though, is that all of these can be helped or prevented with appropriate skincare and home care, and appropriate in-clinic treatments and some lifestyle changes as well. The other thing that can also be a factor in acne and increasing the severity of acne is cortisol. So that is our stress hormone in there. So cortisol triggers the release of blood sugars, and it is released if it's not adequately regulated and released and goes into overdrive, it can then manifest into acne. So it is really important that when we're consulting with our client and when we're trying to figure out ways to combat acne, also asking about their stress levels, because it can play a really big part into the severity of acne. So things like a regular physical exercise allows the body to not only regulate sleep, but it also helps to regulate that adrenal gland. And they play a role in stabilizing cortisol or stabilizing our hormone levels, that stress hormone. Now, because exercise improves our normal daily fluctuations of cortisol, it may also help to normalize the severity of that acne as well. So exercise is not only just good for our health and our weight, but it's going to help to regulate that cortisol and in turn help with the severity of that acne as well. Now, looking at the pathogenesis of acne. So starting here, we can see a little picture. We've got an increase of sebum production, and then we get an accumulation of epithelial cells on the surface of the epidermis, and they then shed keratin into that hair follicle. This then results in a plugging of that hair follicle, or it's creating a clog. It's no longer able to clear out and flow. That sebum can't flow properly because we've got an excess of that and those dead skin cells. Now, that clogged pore doesn't allow oxygen to flow down into the follicle. This then means that we have created an ideal environment for P. acne bacteria to multiply. P. acne bacteria absolutely loves no oxygen whatsoever. So when we get that clogged follicle, when we get that no oxygen flow, that little P. acne bacteria is really excited and he starts to multiply and grow like crazy. Now, that follicle then becomes really full of that P. acnes bacteria, and it breaks and it spills its contents then into the dermis. And this can cause inflammation, which can then result in that loss of collagen and ultimately leading to scarring as well. So acne can be determined or subcategorized into 4 different categories of acne. So we've got our grade 1 acne here, and this is our mild acne. And this is mostly people present with grade 1 acne. They're showing whiteheads, they're showing a few little blackheads there, but not too much inflammation going on just at this moment. Our second grade of acne is our moderate acne, and this has not only our blackheads and our whiteheads, but we're starting to see here different papules and pustules starting to come up onto the face. These 2 grades 1 and 2 are typically seen predominantly on the face. We then get into our grade 3, and grade 3 is our moderate to severe acne grade. We're seeing whiteheads, we're seeing blackheads, we're seeing numerous papules and pustules now, and occasionally we'll see those inflamed nodules. So this is where it's also starting or can start to travel down the neck, down the chest, shoulders, and back as well. Now, our most severe grade of acne is our grade 4. So this is present with everything I've said already. So blackheads, whiteheads, papules, and pustules, but we're also starting to see really quite sore and inflamed nodules and cysts. They're quite large, they're quite painful, and they can cause scarring as well if not properly taken care of. Now, I am interested to everyone on here today, if you can pop into the chat box for me, what is the most common grade of acne that you guys are seeing in your clinic and having to treat in your clinic? Some of us don't get to see all grades, some of us do get to see all grades, or some of us see more grades than others. So what grade of acne do you tend to see more so in your clinic? Is it grade 1, grade 2, grade 3, or grade 4? One and 2, yeah. Grade 1, I tend to see more those grade 1 and 2s. Occasionally, I'd say that grade 3 in clinic as well. But we do deal with a lot of grade 1 and 2s quite regularly. Seems to be, yeah, the theme with everyone, those grade 1 and 2s. Awesome. Well, let's go on and have a look at the type of pimples or the type of lesions that we do see on those skins. So we're going to define all of these, but you've got a whole heap of different nodules or pimples that we're going to see. We've got blackheads, which are also known as open comedones. We've got whiteheads, which are known as closed comedones. We have papules, we have pustules, we've got cysts and nodules as well. So we're going to go through and define all of those ones. And looking here, I've got a brilliant photo. I really love looking at all of this sort of stuff. It gets me very excited. I think it's quite typical as a therapist wanting to see all of this. Now, we're going to go through and really define each one of these, but you've got two kind of categories of your acne lesions here. We've got comedonal acne, which consists of those blackheads and those whiteheads. And then we have our inflammatory acne. So we've got our papules, our pustules here. We have nodules and cysts as well. So let's go through and get bigger close-up photos and really define what each one of those ones are. So we've got whiteheads here. So this is this top one here, also known as closed comedones, and they are block sebaceous ducts, and they come in various different sizes. Now they're called closed because they are enclosed under the surface of the skin. They are very hard to resist picking and squeezing, but once they are squeezed and once they are picked, it leaves an opening on the skin, and this is then going to trigger the body to go into that repair mode, that repairing of the skin, and it can lead to hyperpigmentation. Then we have our open comedones, or also known as blackheads. So these are your sebaceous, well, backtracking from that, sebaceous filaments are natural and they're seen in a really healthy skin, and they help sebum move regularly and help to moisturize the skin. But a blackhead forms when these open pores then start to collect excess secretions of sebum, excess dead skin cells. Then the skin cells raise and they cause a little bump. What happens next is it then oxidizes, so it changes the color or the pigment, which gives it that black dot sort of effect. It's not actually dirt, so it's a buildup of those dead skin cells, and that's sebum that's oxidized in there. Again, very hard to resist not picking. Then we have our papules. Now, papules are small raised lesions. They're normally less than 1 centimeter around, and they form under the surface of the skin. Typically, they don't fill with pus or fluid. Initially, they don't have, scrap that. They don't have pus or fluid in them when they're papules, but what you will find is a precursor to that pustule. So normally if you see a papule come up, that little red raised lump, in a couple of days' time, it will start to fill up with pus. Then leading on to pustules. So pustules are inflamed bumps that are underneath that skin surface. They can be quite tender and painful or sore to touch, and they contain your inflammatory immune cells and bacteria in there. So also known as pus, and it's that yellowish fluid contained in there. Again, we don't want to pick these ones. We want to let our immune system do the hard work for us. We then have our cysts. So cysts are abnormal pockets of cellular material, fluid, hair, blood, or pus that are underneath that skin surface. They're enclosed in a membranous sac, and they feel like tiny little hard balls underneath the skin. I'm sure we've all felt a cyst come up at some point. They can actually be found anywhere on our body, and most of the time how we become aware that we've got a cyst is you feel that little hard bump underneath the skin. Sometimes they can cause pain. They don't always cause pain. It's normally that you feel it first, but sometimes they can cause pain, especially if they grow quite fast or grow in areas that then can cause pressure. So they've tightened up that skin, and you can feel that pressure, like when you get those cysts on the nose and you're like, ooh. The last one we have here is nodules. Now, nodules are bumps that form deep under the skin's surface. They don't contain pus or fluid, and these bumps don't normally have a white head or a blackhead center. Now, nodules can last weeks, even months underneath the skin. Both of these, their lesions are typical and what we see more so in our severe sort of acne. So our severe acne appears at a faster rate and in a higher concentration, and it can lead to much larger and much more visible pustules, more noticeable on the skin. Then we have our cystic acne. So this occurs at a deeper layer or deeper level of the skin. It's very slow to heal, it's quite tender and painful, and lasts a longer period of time as well. As these cystic acne clients that we see are deeper, they can then lead to, or they have a higher likelihood of leading to scarring, which can affect texture and create depressed scars. Now, picking, I've said just before, we need to not pick these. Now, I don't know about anyone else on here today, but I am very guilty over the years of picking little spots and whiteheads and blackheads. I cannot help myself. Over the years, I have definitely learned some self-control, but is anybody else like me out there as well? Just loves a good pick in there. I just can't help myself sometimes. Now, look, the reason why we don't want to pick is because picking at your skin is problematic because it's introducing bacteria, not only from underneath our fingernails, but also what we might already have on our hands. And then we're introducing that bacteria into an already sensitive, inflamed and acne-prone skin. That bacteria then can form new pustules, make them even worse, and possibly lead to serious infection or scarring. So the moral of this story is we don't want to pick, as hard as it is, and we want to really educate our clients not to pick and burst pimples and blackheads and everything as well. So not only picking can lead to even more breakouts, but it also means that we have a higher likelihood of forming scarring. Now, acne scars are any type of scar tissue that develops as a result of acne. Scarring typically occurs when inflammatory acne lesions penetrate relatively deep into the skin, and they result in the trigger of scar tissue formation. Now, there are a number of different types of acne scars that we can come across in our clinics as well. Now, the first one we have here is our ice pick scar. So our ice pick scar is being one of the deepest acne scars that we can see. They appear as a really small, sharp indentation that is wider at the surface of the skin, and they narrow down to a point as they reach down into the bottom of the skin. They literally look like someone's gotten a little ice pick and kind of hacked in there. We then have our rolling scars. So our rolling scars give the skin surface a rolling or an uneven sort of an appearance. They're typically about 4 to 5 mils wide, and that really rolling sort of texture that we can see on clients' skin. Boxcar scars are caused by that destruction of collagen and elastin in the dermis, and they result in an indentation sort of appearance. Now, boxcar scars look punched out. They have like a U shape, almost like a little box shape scar in the skin. They're quite depressed in there. They're very angular in their shape. They're very defined, sharply defined vertical edges. The next one along is our hypertrophic scars. So these are usually raised, although they're very rarely elevated any more than about 4 mils above that skin surface. And they are normally red or pink in color and hard as well. Additionally, these scars do not extend beyond that, the general geographic margins of that scar or of that wound, and they tend to regress over time as well. The very last one that we have here is post-inflammatory hyperpigmentation, or PIH. Now, these normally look like a flat area of discoloration on the skin. It can appear white, pink, red, purple, black or brown, depending on that skin tone of our client and the depth of that discoloration or the depth of that scar as well. Now, PIH can develop on all skin Fitzpatricks. It's not exclusive to one or the other. However, we tend to see it more severe and more longer lasting in people on the higher end of that Fitzpatrick scale. Do we tend to see a lot of scarring in clinic? If we do, what type of scars do you guys normally see? Do you see more ice picking? Do you see more rolling scars, more boxcar scars, hypertrophic or post-inflammatory hyperpigmentation? I typically saw a lot of rolling and boxcar scars, and then your PIH as well. That's what I saw coming through my clinic doors a fair bit. So PIH, someone said, that's a really typical scar that we do see with that acne. We're going to go through in a minute different ways to treat those scars as well. So not only the acne, but we'll also have a look at how to treat those scarring as well. All right, so let's have a look at treating acne now. We've now defined what acne is, what causes acne, the different types of lesions that we can see on an acneic skin, and the different types of scars. So we're going to really look at how to effectively treat acne and acne scars, and what sort of ingredients that we want to start incorporating into our client's skincare diet, and the type of treatments that we really want to be doing in clinic. Acne is a tricky one, and it's something that we always need to remember that less is more. We also want to look not only externally on the skin, but internally as well. So first thing we want to do when we see our acneic client come in is we want to reduce that inflammation. If the skin is angry and in an inflamed state, we want to try and reduce that. We're not going to be able to make too much of a difference if it's inflamed and angry. So we want to do as much as we can to bring down that inflammation so it starts to respond well to everything else we start to do to it. We also want to start unclogging the pores, so exfoliating the skin, gently exfoliating the skin if there's a lot of pustules on there as well. We want to start increasing that cell turnover because we want to start getting rid of that excess skin cell production. We need to also start controlling that excess bacterial growth, which in turn is going to start reducing that lesion count. We want to get oxygen into the skin and into that clogged follicle. So we said that P. acnes bacteria thrives in an oxygen depleted environment. So we really want to pump oxygen into an acneic skin. We want to look at incorporating ingredients such as your oligopeptide 10. Now, this is an amazing little peptide that is going to provide antimicrobial and antibacterial support and really fight effectively against P. acne. It's also going to go in there and reduce inflammation and assist in wound healing. We want to also start controlling that overactive sebaceous gland, but we want to do it in a way that's not going to dry out the skin either, because if we put too many drying ingredients and we strip an acneic skin, what's going to happen? Our skin's going to go into hyperdrive and start producing even more oil. So we're just going to go round and round in circles. We also want to make sure that any skincare that we're using or prescribing to our client is non-comedogenic, so it's not going to clog up those pores. And as I mentioned just before, we not only want to look externally, but we also want to look at internally as well. So we want to make sure that our client has a balanced, healthy diet, that they aren't eating takeaway all the time, making sure that they're getting enough EFAs, so essential fatty acids, and with that, which will assist with that healthy sebum production as well. We also want to support a healthy gut flora. So the gut health and inflammatory conditions are directly related, and we're really not going to be able to successfully treat an inflamed skin or an acneic skin, because it's an inflammatory condition, if our gut is out of balance. So we really want to look at that gut support, look at ingredients like our pre and probiotics in there, digestive enzymes, to really restore and support that gut as well. Now, unfortunately, there is residual effects when we're looking at things like acne. We've talked about that scarring, things like that scarring, that we went through before, those ice picks, the rolling boxcar, your post-inflammatory hyperpigmentation as well. Now, those residual effects from acne are more often, unfortunately, seen in our higher Fitzpatricks. So this is another reason why we want to take a really progressive approach. We want to less is more on both home care and our in-clinic treatments. We want to bring that down, that inflammation, particularly when we are treating those higher Fitzpatricks. So we want to make sure that we've got lots of anti-inflammatories in their skincare diet. Being highly educated on your ingredients, on your skincare, on your collections that you have in clinic is really going to allow you to effectively treat your client's skin concerns. So we're going to look at a few key ingredients that are ideal to treat acne for home use and also in clinic as well. So the first one we have here is salicylic acid. I love a bit of salicylic acid. It is a really effective exfoliant. It's an anti-irritant as well, and it's going to treat acne due to its anti-inflammatory and its antimicrobial properties. It also is going to help to clear out that little clogged pore from the inside out. This is a brilliant one, our BHA there. Another ingredient that we want to look at incorporating into our skincare or our client's skincare diet is glycolic acid. So this is our AHA, often used in acneic treatments, in peels, in cleansers. It's a brilliant exfoliant, and so that's going to start to slough off that excess dead skin buildup as well. Retinol is another brilliant ingredient for those who are suffering acne. It's a very powerful antioxidant. It's going to, again, regulate those cells, and it's going to stimulate collagen too. Going into enzymes now. Now, pumpkin enzyme in particular contains vitamin C, vitamin A, and vitamin E. So all really powerful antioxidants. They're going to help to fight sun damage, wrinkles. It also is going to help to exfoliate the skin in a really gentle way as well. Enzymes are just going to gently munch away at that superficial dead skin on the skin surface. It also contains zinc and potassium, so they are going to help with redness in the skin. Granactive acne is another brilliant blend of ingredients. So Granactive acne has oligopeptide 10, it has boswellia extract and honey extract, and this blend of ingredients reduces blemishes, and it also helps to purify the skin. Arnica montana, another brilliant one because it's anti-inflammatory. So remember I was saying we want to bring that inflammation down. So getting Arnica montana in there is really going to help to reduce that inflammation. We then have benzoyl peroxide. Now this is a brilliant antibacterial ingredient. It's commonly used in acne treatments It is one of the few ingredients out there that is proven to kill that P. acnes bacteria for us. It's also an anti-inflammatory as well, but should be used in moderation. So we really need to keep an eye on our client if they're using benzoyl peroxide. And I would typically reserve this ingredient for your higher grades of acne. So your grades 3 and 4 really benefit from your benzoyl peroxide. Vitamin B is going to reduce pore size. We've got eucalyptus as well, a great antibacterial ingredient. Aloe vera, I love aloe vera for an acneic skin because of those healing properties that it has, that anti-inflammatory. It's really going to calm down that angry acneic skin. And clay. Clay is going to help to absorb that excess oil, but without overstripping that skin either. So leaving it in a really healthy, nourished way, but taking away that excess sebum. So those are your ingredients that are particularly good for acneic sufferers. But then we've got that residual effect, so that scarring effect. So ingredients that can really help someone who's got a lot of scarring going on are things like retinol. So retinol, again, exfoliates the skin. It's going to increase that cellular turnover. It's going to help to unclog those pores, really normalize the skin and boost and support collagen. So all things that we need to help combat scarring. Kojic acid is going to help to brighten the skin. So kojic acid is really good for acneic skins, particularly if we've got a bit of PIH happening as well. It's going to help to even out skin tone on all skin types. So we want to get kojic in there. Malic acid is another one. So it's going to help to reduce the appearance of redness, of fine lines and wrinkles, and also going to help to improve textural issues on the skin. And then the last ingredient here is our tetrahexyl decyl mouthful for the morning, but this is our most stable form of vitamin C. This is a very powerful antioxidant. It is going to brighten the skin. It's going to accelerate collagen synthesis. It is actually 50% better at synthesizing collagen than your L-ascorbic acid. So your tetrahexyl decyl. So now let's have a look at those treatments that are going to be more beneficial for our clients. We've gone through the ingredients that we want to incorporate into our clients' skincare diet and ingredients that we want to incorporate into our clinic treatments as well. But let's look at those treatments too, things that we can do to treat them. Now, our in-clinic treatments are really going to support all that hard work that our clients and you are putting in at home. So they are going to work deeper into the skin, and they're really going to drive those results for our clients. Now, I've said it before and I'll say it again, we do need to be very conscious about less is more. Less heat on the skin, less friction, less products. We want to keep it nice and simple to start off with. We don't want to overdo it on the face. And it's something that I think we've all over the years fallen guilty of. When we see an acneic skin, we just want to throw everything at it and help the poor person. But the best thing for an acneic skin is to pare it back a little bit to start off with. Now, a few different in-clinic treatments that we can do. First one here is exfoliation. So we've said that acne, one of the big causes or factors in acne is an excess buildup of skin on the surface. So the purpose of an exfoliation is to shed that thicker top layer of skin and reveal that smoother underlying epidermis. And this helps acne as it's going to reduce clogged pores, which can lead obviously to those larger lesions. Now, deep exfoliation will help also with scarring as well. Now, there's two main types of exfoliation that we're going to chat about today. We've got our microdermabrasion and our hydrodermabrasion, and you may have both in clinic or you may have one or the other. So our microdermabrasion uses either crystal or a diamond version. There's the two main versions out there. And what it does is it either uses tiny little crystals, typically made out of your aluminium oxide, which are blasted onto the skin through it and with a sucking action as well, or you have a diamond version, which is a diamond abrasive tip. Now, it does this with a bit of suction and it physically buffs away the outermost layer of our skin. Then we have our hydrodermabrasion, which is a little bit more gentle on the skin. So this method uses an active exfoliating fluid plus a little abrasive tip to really flush out those dead skin cells. It's also got the ability to be able to infuse active ingredients into the skin. Now, pictured down here, and some of you may have our biotherapeutic Hydroderm Trinity, which is a brilliant hydrodermabrasion. Absolutely fantastic. It is gently exfoliating the skin, but without any redness or excessive suction in the skin. It is a completely customizable treatment. So we're really able to use this on the most sensitive of skins, right through to those really thickened skin types as well. We're able to do this through different little abrasive interchangeable tips, and along with customizable serums and fluids that we're able to infuse in the skin and really target things like hydration, brightening, or even purifying the skin. So it's going to really gently remove dead skin cells, improve that skin smoothness, reduce pigmentation and congestion, and really boost that hydration and product penetration. Now, probably one of my most favorite things to do on an acneic skin in clinic is LED. LED can be done on every single skin type and should be utilized in every single treatment, but it is particularly brilliant with your acneic skins. Blue light at 415 nanometers is going to have multiple positive effects on an acneic skin. It has antibacterial action without irritation. So blue light at 415 nanometers destroys P. acne bacteria. Now, P. acne bacteria contains a little substance in it called quercophorum 3, and this actually absorbs that blue light at that 450 nanometer. When it absorbs this, it produces a singlet oxygen, and that singlet oxygen is then able to destroy that P. acne bacteria. Your blue light is also going to be able to treat congested and spot-prone skin. It is going to help to regulate oil production. It's going to improve skin clarity. It has a very calming and an anti-inflammatory effect for problematic skin, and it is suitable for all grades. This is my go-to if I have an acneic skin that is inflamed and angry and they've overstripped because they've used stuff from the pharmacy or whatever they've popped on their skin. Blue is where I go to start off with, reducing that inflammation, starting to reducing that P. acnes bacteria. Another one, we have also said that acne is caused by that excess P. acnes bacteria, and P. acnes bacteria thrives in a low oxygen or a no oxygen environment. So when we block that pore, happy little P. acne bacteria, he starts to produce. So what we need to do is we need to incorporate oxygenation treatments. Now, this is an example of one of the oxygenation treatments that we do have at Professional Beauty Solutions, and this is our Oxygeneo. If you have heard of it or know of it, you know, this is an absolutely incredible treatment because not only is it going to physically exfoliate our skin and assist with product absorption and nourishment on the skin, but the Oxygeneo treatment harnesses the body's own natural process of oxygenating the skin from within, and it does this through a process called the Bohr effect. what happens is this is where our body sends oxygen-rich blood to the skin's surface or to the area that we're creating carbon dioxide-rich environment, and it's going to replace and push that oxygen into that skin surface. So what this results in is highly oxygenated skin, increased cellular turnover, and when we've got acne in there, we're putting more oxygen into that area, which is going to kill off that P. acnes bacteria. The last thing that we can do in clinic, well, not the last thing, but the last thing that we're going to talk about it today is those internals. So if we truly want to be able to treat an acneic skin and see true transformation in the skin, we can't just treat externally. We need to look at our internals. The first thing we're going to go through is those essential fatty acids. So EFA deficiency is one of the most common cause of skin problems. And this is because EFAs are responsible for oil regulation. And a deficiency can be present in either dry or oily skin, and both can contribute to excess or clogged oil. So we really need our EFAs in there. EFAs are going to moisturize the skin on a cellular level. They're going to feed the skin at those deeper layers. As these cells then progress to those upper layers of the skin, it's going to release its beautiful oils and result in plump, supple, smooth, glowing skin. EFAs are going to prevent congestion and spotty, breakout prone skin, as it's able to dissolve existing blockages caused by really sticky, irritated sebum. So it's going to improve the quality of sebum that our skin is producing as well. Now, the other thing is the gut. So I was going through that one before. There is so much research out there these days about that gut-skin connection. Our gut is home to a complex ecosystem of bacteria and fungus, and poor diet, ill health, can deplete those colonies of microbes, and it can lead to gut disorders. This is then reflected in our skin, in that inflammation, in that acne as well. So we need to look at incorporating ingredients into our clients' skincare diets, such as things like our prebiotics, our probiotics, and our digestive enzymes as well. So other things we can recommend to our clients are things like changing the bedding weekly. So making sure we've got fresh sheets, fresh pillowcases, again, that healthy diet, looking at what they're eating, making sure there's not an excess of takeaway fatty foods in there, making sure there's not an excess of sugars in there as well. Suggesting that they use mineral makeup, and then also teaching them how, or educating them to wash their makeup brushes on a regular basis to get rid of any sort of harboring bacteria. We need to educate them not to touch or pick their face. That's a hard one. I've already said that's a hard one. So a good suggestion is to keep those nails short. We want them not to over scrub their face, and also to wash their hair regularly. If they don't wash hair regularly and have an excess sebum, you can start seeing lots of breakouts. Or if they're wearing their hair over their face, that's another thing that can also increase that excess sebum production as well. The other thing that's really useful for your acneic clients to suggest is to keep a little journal of when their acne starts to inflame and get really bad, and when, what sort of triggers. Maybe it's something that they've been doing, maybe they've been stressed, maybe it's that time of the month or something they've eaten as well. So keep a journal and start having a look there, and eventually we'll see a little bit of a pattern come out of that as well. And it's really going to help us to be able to effectively treat and recommend how to treat them as well. All right, everyone, thank you so much for listening today. Do we have any questions on any of that? I hope we've all learned a little bit here on how to treat acne, those conditions, different ingredients as well. Well, thank you everybody so much for joining us today at our Tuesdays at 10. Remember that we will be back here next month at Tuesday at 10 a.m. and we're going to go through retail training. And if you do have any questions or any suggestions of subjects that you would like us to go through, please reach out to us. We'd love to hear from you as well. Hope you all have a fantastic day and we will see you next month.